Dear students, Assalamu alaikum. Hope you are doing fine and observing the direction. Stay home, stay safe. I also hope that while staying home, you are not losing your focus on studies. This might be the best time for early preparation of your exam. We are currently learning about epidemiological studies. During the last lecture, we started our discussion about experimental studies, especially the randomized controlled trials. If you are following news about search for treatment or vaccine for COVID-19, you must be aware that randomized controlled trials are extensively employed in this regard. Today, we will continue our discussion about experimental studies and will try to learn about the inherent biases in RCTs and the means by which such biases are reduced. We will have discussion on advantages and disadvantages of this study design, and we will also focus on the non-randomized trials, especially their types, advantages and disadvantages. Now we will focus on the possible biases that can occur in randomized controlled trial. Bias refers only to error which is systematic in nature, that is, systematic distortion of a statistical result. Three types of biases can occur in this design. The first one is participants' bias. Participants of the study, when come to know that they are receiving a new form of treatment, they start feeling better subjectively and report improvement in their condition. It is participant bias. This is also known as subject variation. The second is observer's bias. It occurs when the observer knows beforehand the particular procedure or therapy to which participant has been subjected. Bias in evaluation is the third type of bias. This can occur at the time of evaluation. Sometimes it may happen that an investigator subconsciously give a positive result and a favorable report of the outcome. It is not possible to minimize or control these three biases by doing randomization. A technique called blinding is adopted to overcome this problem. What is blinding? Blinding refers to the act of masking the nature of the treatment or intervention from people involved in the trial. In a trial, when group assignment or nature of the treatment is known, participants may report symptoms of disease outcomes differently. Investigators may elicit symptoms differently. Analysts may classify similar events differently in study group. Bias arises from these three sources in a trial and systematically distorts the study results. The best way to protect a trial against these three biases is keeping the people involved in the trial unaware of the identity of the groups and intervention for as long as possible. This is called blinding. ब्लाइंडिंग क्या होती है? जब हम जो लोग स्टडी में इन्वॉल्व हैं, फॉर एग्जांपल नंबर 1 पार्टिसिपेंट और सब्जेक्ट्स, इन्वेस्टिगेटर और रिसर्चर और स्टाफ जो एनालिसिस स्टडी की कर रहा होता है, इन तीनों ग्रुप्स को अगर हम ये ना बताएं कि कौन सा ग्रुप स्टडी ग्रुप है और कौन सा ग्रुप कंट्रोल ग्रुप है, और उनको ये भी मालूम ना हो कि किस टाइप की इंटरवेंशन और ट्रीटमेंट दी जा रही है इस स्टडी में, ये प्रोसेस ब्लाइंडिंग कहलाता है, क्योंकि जब पार्टिसिपेंट को, रिसर्चर को और जो स्टाफ एनालिसिस करता है उसको ये मालूम होता है कि कौन सा ग्रुप स्टडी ग्रुप है, कौन सा ग्रुप कंट्रोल ग्रुप है और हम क्या ट्रीटमेंट या क्या इंटरवेंशन दे रहे हैं, तो उनके बिहेवियर में थोड़ा सा बायस आ जाता है और ये बायस हमारा रिज़ल्ट डिस्टॉर्ट कर देता है। तो हम अपने रिज़ल्ट को डिस्टॉर्शन से बचाने के लिए हम ब्लाइंडिंग करते हैं। Blinding is of three types: single, double and triple. The first one is single blinding. In this type, only patient or subject is unaware about the identity of intervention or treatment, but chances of ascertainment bias are still there. Second one is double blinding. In this type, participant and investigator or researcher both are unaware about the identity of the groups and intervention or treatment. Only the data analyst knows about this information. However, chances of ascertainment bias are still there in the study design. Third one is triple blinding. In this type, participant, investigator or researcher and data analyst, all of them are blind. They are not aware about the identity of groups and intervention. Coding is employed for masking identity of groups and intervention. So there is no chance of any bias to occur in this type of blinding. This is an ideal type of blinding. Triple blinding is an ideal type of blinding because there is no chance of any bias. However, double blinding is the most commonly used method in trial. Now we will discuss different types of randomized controlled trials. Number one is clinical trials. This trial is regarding new drug, new operative procedure or new technique. Ethical, administrative and technical problems can occur in this type of trial. Next trial is preventive trial regarding preventive strategies, preventive measures. Third one is risk factors trial, trial regarding modification and evaluation of risk factors for a particular disease. Next one is cessation experiments, termination of habit, discontinuation of an habit. For example, discontinuation of habit of cigarette smoking in case of lung cancer. Next trial is regarding trial of etiological agents for a particular disease. Last one is evaluation of health services. Trial to evaluate efficiency and effectiveness of health services, and we can find out by conducting operational research and health service research. Now we will focus on advantages and disadvantages of randomized controlled trials. First, advantages. It is called the gold standard. That is, it is the best method to study causal relationship as exposure is under the control of investigator. So, this design is best to study cause and effect relationship or to study temporal association. By blinding, we can control inclusion bias in this design. Confounding is also under control. RCT can evaluate effectiveness and efficiency of health services. These are some advantages of randomized controlled trial. Now the disadvantages. It is an interventional or experimental study, so ethical concerns may arise. In this case, exposure or treatment alternatives should be acceptable to both groups, otherwise compliance problems may arise. This study is very expensive. Financial costs are very high. In it, usually long-term follow-up is required to reach the final conclusion. So, chances of losses of participants are there. As we discussed earlier, experimental studies are of two types: randomized controlled trials and non-randomized trials. We have talked about randomized controlled trials in detail. Now we will discuss the non-randomized trials. Although randomized controlled trial is always to be preferred, sometimes it is not possible to conduct a randomized controlled trial, especially in human beings, due to ethical and administrative issues like cost and logistics. Then non-randomized trial is indicated. This design is not as sophisticated as randomized controlled trial. There are three subtypes of non-randomized trials. Number one is uncontrolled trials with no comparison group. This type of trial is conducted without any comparison group. Second is natural experiments. There are some circumstances when experimental study is not possible on human population due to ethical consideration and logistics. As an alternative, the researcher identify the natural circumstances which mimic an experiment. For example, earthquakes, famines and flood, and effects of war on and mass migration on population. The researcher studies the effects of such happening on diseases and deaths. Third one is before and after comparison studies. These are community trials and are of two types. Number one is before and after comparison without control. For example, in it, researcher finds out and compares incidence of disease before and after introduction of a preventive measures. Number two is before and after comparison studies with control. In this, researcher finds out and compares incidence of disease after introduction of a preventive measure and compares its result with another population where preventive measure is not introduced. Now we will discuss advantages and disadvantages of non-randomized trial. First, advantages. Its advantage is that it is less costly and has minimum logistical and administrative issues. Disadvantages or drawbacks of non-randomized trial. Non-randomized trial is crude and less sophisticated as compared to randomized controlled trial. As randomization is not adopted, in it there are less chances of comparability and reliability. It is difficult to establish causal relationship and chances of false results also there. Dear students, with this we have completed the subject of epidemiology. Now go through it, revise it, do revision of the followings: introduction of epidemiology, measurements in epidemiology, measurements of morbidity, mortality, incidence, prevalence, epidemiological study designs. How we can find out prevalence? We can find out prevalence by conducting cross-sectional study. We can find out odds ratio by conducting case control study, and we can find out incidence and relative risk by conducting cohort study. Also revise biases in study designs, means to control it, experimental study design, randomized controlled trials, non-randomized trial association and causation during next few days. Do exercises given to you. Best of luck and Allah Hafiz.